Hey guys, it's Rebecca. I'm going to be doing my presentation over vision and hearing. So, changes in vision as we age that we can expect to see are a decreased ability to see the objects that are really close to our face, which is also caused presbyopia. And with these patients, we can expect to see them wearing reading glasses or using a magnifying glass for close-up work. Um, as well as the eyelids will begin to lose their flexibility, which will cause a sagging effect. And this can cause some reduced vision and excessive tearing, as well as some itchiness in the cornea. Um, and then the goblet cells actually decrease in efficiency to produce our mucin to lubricate the eye. So, from that, you could understand that it's extremely uncomfortable, and your patients may need some eye drops or something like that. Um, as well as the cornea becomes flat, dull, and thick. This can cause increased farsightedness. And then the anterior chamber becomes small in size because of the thickening of the lens, and this can cause increased intraocular pressure, which can often lead to glaucoma. Changes that we can expect to see in hearing, as well as the ear itself as we age, is that the auricle can begin to lose its elasticity and become larger as well, just like the eyelid can begin to sag just because the skin all over the body loses its elasticity. Um, and then the cerumen glands decrease in their efficiency. And this causes the earwax to be solid and dried out. And so that can cause some temporary hearing loss. The malleus and the stapes can calcify, and that can cause a problem with the transmission of sound waves to the auditory nerve, which can cause some hearing loss. The hairs in the ear can become coarse and stiff to touch. Um, and this can happen especially in men. And then hearing loss affects at least 80%, if not more than that, for the population of people over the age of 85. So we really need to be aware of these changes and be sympathetic, empathetic to our patients, um, because it is happening to so many of them. So when you're assessing your patients, a couple of things to look for um, are going to be that the eyelids are going to have a slight change in position. They're just going to be drooping down a little bit. Um, and then when you're using your pen light and you're doing your perla, you may notice that the pupils are not responding as effectively. And that is from just using those eye muscles constantly. And then you may see a gray ring around the iris. Um, and then the patient can kind of express an intolerance to bright lights or certain types of glares just because that pupil doesn't constrict as well as it used to. So there's a lot more light coming in and it's irritating to the eye. Um, then the patient, if they're reading or trying to focus on some small text, they might ask for some extra lighting in that form, but that's completely normal for them. And then they may have a hard time distinguishing colors as well. Some changes, some assessment changes in hearing that you may see as you are taking care of older patients is you can expect to see hearing aids on a lot of your patients, and if you don't see them, just ask them if they have any so you know that they can actually hear you well and understand you. The tympanic membrane on the inside may be a gray color. And then oftentimes patients who have hearing loss can be accidentally diagnosed with dementia, which a lot of times is a false diagnosis. So we just need to be aware of that and be cautious to not do that to our patients and know exactly what is going on. And then the ears will be a little bit larger just because of that loose skin, and that happens a lot of times in men, but it does happen in females as well. So for the patho of our vision, we'll just explain why the eye is more susceptible to infection, and that's just because the barrier of the eye is impaired, as well as there is a decreased ability in the elderly's body to fight off the neutrophils, which is also called your phagocytosis. And then your corneal homeostasis, it may be thrown off because the body no longer has the ability to make extra epithelial cells. And then you also may see some fatty deposits in the limbus, and this can cause arcus senialis or gerontoxin. So on this next slide, I just kind of want to talk about the big ones, the big eye diseases, so the cataracts and glaucoma. And so cataracts can happen to the elderly because of deposits of proteins in the lens. And this can destroy the plasma membrane and can cause the patient to become hyperoptic or myopic. And that fatty or that protein deposit can cause that cloudiness there in the eye. Glaucoma can happen to the elderly population because of the thickened trabecular sheets due to accumulation of curly collagen and pigment of the trabecular membrane, as well as their pores are not open as much, which means that more fluid is staying in, which means that there's more pressure build up, as well as a buildup of laminin also. That can lead to that extra pressure in the eye. So for our patho for hearing, the outer ear loses its stretchiness and ability to recoil back to its normal position just from the loss of elasticity in the skin. The hairs inside the ear will become firm, and the drying and thinning of the tissues can cause earwax to build up in the ear, and this can often result in conductive hearing loss or temporary hearing loss as well. And then the ossicles can become calcified together, and this can cause an impairment of sound through the ear, and that can really harm your patient's ability to hear. So just be aware of that and look at that. And assess that. And then your sensory proboscis can occur because of the wear and tear of the spiral organ in the cochlea, and this can make it difficult to hear those higher pitched sounds, or yelling or screaming, or consonants or and stuff like that. So just be aware of that when you're communicating with your patients. Some important education points for vision for your caregivers as well as your family members are to encourage your patient or family member to have those regular eye checkups, because we want to pick up any abnormal findings as soon as we possibly can to address those problems. And then just encourage your patient to always have on their correct prescription glasses, and to not buy the cheap reading glasses at Walmart if that's not what they're supposed to have, because if they're straining their eyes all the time, they're actually making their eyesight worse. And then eating vegetables, especially green vegetables, can help protect against some eye diseases such as cataracts and AMD. Um, and then you should remind them that exercising is really important for your eye health, and that's just because circulation and oxygen are used in your eyes too. And you may not think they are, but they are. So just let your patients know that and be aware of that. Um, and then I just put this little fact in here. Once your patient or family member is the age of 60 years or older, they're going to require 3 times more light than the average person, um, just so they can see the text better. So just be aware of that. If you're taking care of a patient, don't turn the lights off if they're reading, and just little things like that. So some helpful education points for patients who are hearing impaired for both the caretaker and family member are to face your patient when you're communicating with them so they can see you clearly, and utilize those nonverbal cues that you are using in case they cannot hear every word that you are saying, as well as speak slowly, enunciate your words, repeat words if you have to for an easier understanding for them, and it'll also be less stressful for them. And then I know the tendency is to raise your voice when you think someone can't hear you, but that can actually cause a higher pitched noise, which they often cannot hear. Um, so it may actually be harder on them to hear you when you raise your voice. Um, as well as if you raise your voice, it may embarrass them. So just try to avoid that and try to push down that tendency as best as you can. And then use touch as well as a helpful tool, an extra tool to communicate with your patient if it is appropriate for the situation that you may be in. All right, guys, that is it. Thank you for listening.